Few questions.
Yeah. Hello, viewers. Good evening. This is Kaushalya Rajkumar this side. Welcoming you all to an awesome session once again. So just imagine you are amidst a lot of relatives in a function or at a park in a mall, and all of a sudden the little one starts getting aggressive. How do you tackle the situation? This situation especially can be a literal nightmare to many parents here, and I'm pretty sure all of us, including me, would have been in that tight spot at least once in our parenting journey. So here comes our live session. Join us in the live session where we have our session expert, Dr. Sameer Rao, to help us tackle the situation. Is my voice audible? Hello, viewers. Can we have a hi, hello, so that I can confirm that my voice is clear? Hello, hello, viewers. Hi, Shweta. Thank you, thank you. Just give me a minute or two. I'll be back. Hello, doctor.
Hello, hi.
So, viewers, so I guess most of us would have been in that situation. So, join us for the session. Here we have Dr. Sameer Rao, who is a consultant pediatrician and a neonatologist. He has graduated his MBBS from Government Medical College, Bellary, with an specialty in pediatrics from Kanji Kamakodi Child Stress Hospital, Chennai. He has a wonderful experience and expertise in managing critical babies in neonatal intensive care unit and pediatric intensive care unit. He is also awarded with diplomat in National Board NBE Delhi. Dr. Sameer comes with very rich experience in working with leading pediatric hospital, is also a member of Indian Academy of Pediatrics and member of Royal College of Pediatrics and Child Health, United Kingdom. Glad to have you on this session, Doctor. Welcome.
Thank you. Thanks for the kind introduction. And good evening for all the viewers. In this short session, I'd be hoping to solve few of your concerns or doubts regarding how to tackle an aggressive baby and whether the aggression is common, is it anything abnormal, or when it has to be addressed to your pediatrician, and what common things we can do to prevent or sort out this aggression at the early age and also going on into teenage and adolescence.
Okay, so let's go into the session, doctor. Doctor, what are the common reasons which are behind this aggressive behavior in children?
Aggression, there are different, actually, if you see it as a spectrum of light, the aggression varies from very common temper tantrums where the child is trying to tell us something to a very aggressive sense, in the sense the child is beating other child, hitting, biting, kicking out, or yelling at top of its voice. So it's a wide spectrum. And the most common reason would be some emotional or behavior issue. So the depending on the age, the toddler, 1 or 5 years of age, they cannot express what they want in a very objective manner. So they are trying to express their concerns, be it an emotion like fear, anxiety, or their wants which are not being met. So it might be they're let out, or they are indirectly asking for your attention. So mostly it's a social, psychological, and emotional reasons which leads to aggression. And depending on the situation, the reasons might differ.
Doctor, how can the parents differentiate between a normal behavior of a kid and when the kid is aggressive?
Normal behavior, see, depending on the age, some temper tantrum. Suppose the child is asking for a toy, or you have been in a toy shop asking for a particular toy, you're not giving it, and he's showing aggression. That's fine enough. He's being in a park, he's not want to wait for the turn, he just wants to jump in, push others. That is not still okay, that's medium. But unnecessary going on and beating others, kicking others, then that's a upper end of the spectrum. So some amount of aggression in kids is normal. We have to appreciate it and encourage it, because that's his behavior. He is trying to establish his individuality. He is trying to establish his wants, his preferences, and what he doesn't like. So we have to give some leverage for the kid to express himself, but when it is over the particular line where the aggression is unwarranted. So there is no situation or there is nothing that's provoking the child, but still he's showing aggression. Then that is an unwanted aggression which has to be addressed. Or some behavior doesn't meet the social criteria, social norms, like stealing, kicking unnecessary, or pushing other kids. This is crossing the line that has to be addressed at the earliest.
Okay. Doctor, suppose we are in a function, like I said earlier, and there is a fight between two kids. So, and a particular one starts screaming in the top of the voice to get something, some other toy from the other kid. Will that categorize into the aggressive behavior of a kid, or is it normal behavior?
That's normal behavior, depending on the age. If it's a 2-year, 3-year, or 4-year-old kid screaming and pulling at the things, then that's normal for that age. But if it's a 8-year, 10-year-old kid doing the same thing, that's abnormal, because he is in a age group where he can understand what's right and what's wrong, what has to be shared. So aggression in such a kid is not okay. But at the same time, you have to nip it at the bud. If it's some other toy, or which is not, he is not an owner of the toy but still is very aggressive regarding it, then you need to address it at the same time, and let the kid understand that, yeah, the way he's expressing his desire to want that toy is right, but at the same time it is not his toy, so he has to wait for his turn, or presently ask the other kid to share the toy. That will help the kid to understand that, yeah, what I felt, the emotion is right, but the approach what I'm doing is not correct. So that will help him to modify his approach rather than showing aggressive behavior.
Doctor, are there some any effective strategies for preventing this aggressive behavior in children?
uh, Prevention in the sense, it all starts from listening to your kid, rather than whenever the child starts aggressing, then it's like a start of war between the parent and the kid. So who is right and who is wrong? So, and
Absolutely.
whenever the kid asks something or shouts, the parents feel that offended, or they try to get the kid immediately online. Rather than that, at the first instance, the parents has to calm down, listen to the kid, why he is showing that aggressive behavior, what he wants. It might be what he is demanding is correct at that age group, and then you need to slowly make him understand why he is feeling that, why the kid wants that, but this is not the right approach to get the things done. And somewhere down the line, if it is still not being effective, then the parents should draw a line, or it should be some rules or discipline where the kid is allowed to cross some level, but aggression beyond a certain limit is not useful. Am I audible?
Yes, yes, doctor, absolutely, you're audible. Okay, doctor, can there be any emotional or psychological factors that can attribute to the aggressive
Hi,
behavior of a kid?
I'm audible. I think
Yes.
Kosara is out of network. Yeah, right. So other preventive strategies that might help is a music therapy, art therapy, which will help the kid to calm down. In an older kid, adolescents, mindfulness or meditation might help to solve this aggressive behavior.
Okay. Can there be any underlying reasons like psychological factors or any emotional factors? Maybe a child is felt left out. Like usually when the second kid arrives, the firstborn is he or she feels a little low that my mom or dad is not giving their attention to me. So could these reasons be a cause of the aggressive behavior in children?
You're very right. You're very right in the sense that there is an emotional factor associated with aggressiveness. Once it's weight less than 1 year old, it's more, the aggression is more towards the discomfort or the hungry. The child, baby is hungry, just needs milk. Or as the kids grows up, it has other emotional influences. Now that the school has started, a toddler who is newly going to a school, he'll be feeling that separation anxiety. He wants to be with the parents, so he'll show aggression whenever going to the school. And jealousy, sibling jealousy is well defined. Till that time the new baby is born, he is the center of the world, attraction, all the parents, grandparents are loving him, suddenly all the attention goes off. He wants to ascertain his dominance. That is for all the human beings. All the kids are little adults, so he wants to be in the control, show his dominance. It's not happening, so they will vent out their emotions in the form of aggressiveness to grab your attention. So at this point of time, you need to understand why they're doing it and then address the same way. And adolescents know what is happening is with the advance of media and also the movies or the internet, which are going to a lot of violent things going on the internet space. So that also is aggravating the aggressive behavior in older kids and the teenagers. So an environment also matters. If there is aggression going on in their own house, the parents are fighting amongst themselves, they see their neighbors fighting, their friends father or mother fighting against each other. On the roads we see a lot of aggression. Whenever you park a car, wrong car enters, then you keep shouting at the other vehicles without the knowledge that the kid is sitting at the back seat. So they'll all silently watching you. They use you yourself as a model. So they are constantly learning things. And with increase in diverse rate, single parent, the emotions are very different. So he needs more attention. Nuclear family, previously there was a joint family, he had other kids, other siblings, cousins to vent out their frustrations. But nowadays it's a closed space. So that is adding on to the aggression.
Okay. So, doctor, literally, like when parents or any elders at home, they fight or they argue, that will also affect the kid, right?
Definitely,
In a
modeling
very
definitely matters. So the way you vent out your frustration, the kids will behave, because at the end of the day, you go home tired. You'll not. The kid is thrown his toys around, or he's not ready to sleep at night. You are tired, so you want to sleep. So you're forcing the kid to sleep. But he wants to spend time with you at the end of the day. Then you are showing your aggression. No, you have to sleep. I'm switching off the light. Then he resorts back, the kid resorts back, boss, no, you cannot go all the way you want, so I want to do this way. So that happens. The way you fight with your spouses, there the child will be silently observing, and when you shout at your wife and get the things done, so he thinks whenever I shout I can get the things done. And whenever that happens once or twice, then he knows that, "No, okay, when I show aggression, it's a blackmail technique, I can get my things done." So he feels that's the right thing to do.
okay. Doctor, how can the parents help their kids, to develop some sort of emotional stability, like how to handle a situation when the kid is angry or like most of the times the kids are not able to express themselves very properly at very young age. So how can the parents help them to regulate their emotions or, like to balance their emotions?
Yeah. First of all, it starts off as we discussed right now is a modeling behavior, how the parents act in front of the kids whenever they are on the street, responding to their neighbors, friends, or with their own spouses. The way they get the things done, when they show the aggression, when they don't show the aggression, that helps a lot in first instance. Second is the discipline. Discipline in the sense, most of the parents think when I say discipline is punishment. No, discipline means to learn, to help the kid learn, teach them what are the emotions that they are going through, and is it right, not right, and how can they deal with it according to the age preference, the way they can understand. So toddler, the way you talk to them would be different. The adolescents would be different. You can tell them moral stories. So this is way it happens, aggression. Then you need to cut down. This is the harmful effects, and providing the right guidance goes a long way. And to some extent the prevention also, what I see kids nowadays is the parents are always hovering around the kids. Don't do this, don't do that, don't do this. They are frustrated at the end of the day. So somewhere you should draw a line. If it's prevention, it can be prevented. Make sure the TV is placed high above the kids level, instead of telling the kid every time don't touch the TV, or put a lock to the railings or steps so that he doesn't go to the balcony and lean over. Instead of shouting don't go to the balcony, don't go to the balcony, the kids get frustrated. Wherever you can prevent things, get it prevented. Or also, as I told you, the music therapy, art therapy goes on. And whenever a kid is showing aggression, respond immediately. So a kid is beating another kid. Don't wait for 2 or 3 times and then say, okay, you bet him 3 times. Don't do it again. No, at the first instance, you should go and tell him, no, what you're doing is not right, and be consistent. What happens if the child is biting the mother, the father laughs. Oh, he's so clever. He's biting and getting the things done. That doesn't happen. If you are consistent, if you don't want the kid to bite or hit others, every time the kid does it, you should behave in the same way. Sometimes you laugh it off, sometimes you're very angry. Then the child doesn't know the difference. Is it right, wrong? Because the way the parents are expressing is different. So there should be certain rules of the house. Boss, this is the rules of the house, you need to follow that. If you're crossing this rule in the this one, so you are getting this cannot be done. Okay. And promote good behavior. We are always talking about aggression and what not to do in a child. Instead, whenever the child does something good, then acknowledge it, praise it, then the kid will be fine. So suppose when he's sharing his toys, then praise him. When he's taking turns to play with the other kid, praise him. So this will go a long way. Or if he's helping his sibling to get ready or something, yeah, the positive reinforcement is always good. And as I told, the moral lessons, the way you talk to the child, listens to them, it will calm the child down.
Let me check. I also remember reading somewhere, doctor, the previous, compared to the previous generations, the recent generation kids, they learn the word no very fast, because we always keep telling them, don't do that, no, not that, no, not this. So I remember reading this somewhere on the internet or something.
Definitely
So
true. To some extent, we are trying to put all the expectations on the shoulder of the child. You are not allowing him to be creative, express the way they want. We want them to follow the strict line. Go this, do that, do that. We are very possessive of your children at the end of the day. So we want them to be the best or the ideal human being. But to some children, should do mistakes, should do some mischievous things. That's how they should grow. We should not curtail their instincts too much. That leads to frustration and anxious behavior in the kids.
I know kids are to be mischievous.
Yes.
Okay, doctor, should the parents, sit and explain the kid that whatever you have done is not a very good thing to be done? So will that reduce aggressive behavior in kids over a period of time?
Yeah, it depends on the age group. If you are going to sit down with a 2 year or 3 year old kid and explain that this is not right, this is not this, then they don't have that abstract thinking. If I do this, this will happen. If I do that, that will happen. No, they don't have it. So they understand only the language of this is the extent I can do. Beyond that, I cannot do. In such a kids, if you keep on explaining, after 10 minutes, they forget what you have spoken 10 minutes ago. So there's no point. Based on the age, you need to react. So in toddlers, probably the best thing that helps is discipline and also have consistent rules. So these are the rules which you need to follow. Beyond this rule, I'm not going to entertain you. Then yes, the kids also know. No matter how aggressive I am, if I want this thing, if I keep on shouting, also the mom is not going to give it to me. Once the kids realize that this is my limit, you'll stay to that limit. If it's an older kid, yeah, you can tell them some stories, make up some stories, say this is have to happen. Then they can understand that 8 or 10 year old. But in a teenage group, yes, you need to sit with them, act like their friend, first understand what they are going through, why are they expressing the way they are expressing, and probably to address them. But at the end of the day, you have to acknowledge that the emotion they are feeling is very true. Okay, if you dismiss their emotion and say no, you are wrong, always wrong, so what you are doing is always incorrect, then no, whatever you say, they are not going to budge. Address their emotions and then try to change it. Probably that will help them.
Okay. Doctor, are there any dietary, like dietary factors or any lifestyle changes which could either aggravate the situation or calm them down? Will
Life
any dietary changes, give them a little lesser impact?
One dietitian always tell my patient is Nowadays, parents tend to give lot of milk and the fast food for the kids. Lot of milk and sugar will pump up their energy. Their glucose level is very high. Their energy level is very high. They have to spend out their energy. If you're just sitting, going to school and coming back, sitting in front of a computer or TV all through the day and doing some abstract work in the house, their energy is not at all spent. So they want to vent out their energy in the form of aggressiveness, jumping around, hitting things, throwing things, because the energy is built up. So either you cut down on the carbohydrate rich food. Milk, I definitely say cut down on the milk intake in the kids, and fast food, definitely no. And also provide a space where the kids vent out their energy. So 1 hour of physical activity is a must for the kid, up to teenage group, where they sweat around, not just sitting and playing with indoor games or something. It should be a physical activity where they burn their calories and also they sweat around. So that will calm them down. And if you feel that the child is very aggressive, take him out for a walk, take him out to a fresh air or a park. Let him play 10 times, 12 times, let him go down the slide. Then his emotions, everything will calm down and he'll behave in a proper way.
Doctor, are
And
there
also,
any?
if I may add to the lifestyle changes, routine, setting up a routine in the house goes a long way. So nowadays, weekends we tend to sleep late, go for parties and sleep at 1 o'clock, 2 o'clock. Kids sleep at 1 o'clock, 2 o'clock. What I'm seeing, get up late, 10 o'clock, 11 o'clock, and Monday you want them to get up by 7 o'clock to go to the school. That doesn't happen. When some days you eat at 2 o'clock, some days you eat at 8 o'clock. That doesn't happen. So set a routine for your kid. So this is the time you go up, get up. This is the time you go for a bath. This is the food time. So when the routine is set, usually the kids stick to the routine.
Yes. Uh, so, doctor, are there any red flags? Like at certain point where the kid will need a professional help to tackle this situation.
Few of the red flags are, as I addressed before, some reaction to a situation. The aggressiveness is okay. He has seen a toy, he's not getting a toy, he's showing aggression, that's okay. But the aggression is persisting beyond 1 week, 2 week, 3 weeks. The kid is continuing to cry or showing that disturbed behavior, where the aggressiveness is without any reason, where the aggressiveness is harming the child himself. He's continuously banging his head, or he's harming himself, or he's harming other people. He's trying to hit, beat, or kick someone. Or if it is associated with other problems, conductive or social problems, in the sense he's very hyperactive, not sitting in one place, not concentrating, developmental delay, then this aggressiveness should be addressed by a pediatrician.
Okay. Um, does aggressiveness lead to self-hurting also in kids?
Yeah, definitely. They start off with 1 or 2 years. We have seen kids headbanging themselves when their needs are not met. They tend to vomit. Some kids even get unconscious, or some kids try to cough. This happens, and in their aggressive behavior, they hit themselves against any sharp objects. Yeah, they tend to harm themselves. And we have seen, because of this disturbed emotions in the early childhood, as they grow up in the teenage, this aggressiveness they cannot show off, or if their emotions are pent up, then can lead to suicidal tendencies and hurting themselves. So a lot of problems, psychological problems in the teenage or adolescence, might be because the way they have been addressed emotionally or psychologically in a young age. So this goes a long way.
Oh. So parents can effectively do communicate to kids of about certain age. Correct, doctor?
Definitely, definitely. According to the age, you need to communicate. So that, I always say, when parents come to me and say my kid is aggressive, what to do? Instead of doing something, listen to your kid. That's the first step. Listen.
Exactly.
Why is the child doing the way the child is doing? And if we feel that it is right, then address the child. If the child is wants a toy which the other kid is having and is showing an aggression, then you talk to the kid. Right, what you're feeling is correct. You're feeling sad that you're not getting that toy. You're getting feeling frustrated. What are you feeling? Okay, you're sad that you're not getting that toy. Why don't you go and ask the kid? Why don't you go and ask them to share the toy? Or why can't you give one more toy and take the other toy? or just go say, please give me the toy, or okay, he's not going to give it, that's okay, you can get some other day some other toy. So the way you address things, or if it's a teenage, then talk to them, understand their problems, then it can be met. But some sort of aggression is normal. I At the end of the day, we shouldn't treat or address all the aggressive behavior. If it's going beyond the point, talk to it. Some amount of aggression is okay. That is actually a creative way of the kid to express their psychology or emotions. Let them vent out their energy. There's no harm. He is not going to school at your home, so there should not be too much of strict behavior at home. That's okay. Some amount of jumping around, shouting, some amount of small amount of throwing things is okay, but shouldn't go beyond that point.
Okay. Doctor, we have few questions from our viewers. Can you please help them? Hi, doctor. My daughter has developed a habit of hitting herself if we deny her demands. How to tackle it?
Yeah, your daughter is very clever. More clever than her age, probably. So she knows your weak point, all the nerve. So she is using it as a blackmail technique. Okay. So she knows if she start hitting herself, you will do what she wants. All the kids are, they want to be the king and queen of their house. They want to attain the
Exactly.
supremacy, right? So what I suggest is, if she asks for around 10 or 12 things in a day, five things which are smaller things, if she wants a toy or a small pen or a small this one, give it to her. That makes her understand that yes, the parents are listening to me. If I ask few things, they are giving it to me. So five or six things, give it easily. Another three or four things, you say no initially, then talk to her why she wants it, and then give it to her. And but one or two things which are not acceptable, be very firm in your decision. The way you say no, the way you say no, this is beyond the point, I'm not going to give it or do it. Then at that, the way you talk, the way you express your this one, the kids will understand it. Okay, this is the limit. Out of 10, I have reached 8. No, it's no use, no point in doing it. So don't give in to them at every point. Some way you have to hold it. And in spite of that, if she continues to hit herself beyond a point, just neglect it. Act like as if you don't care at that point, because tell her that what she is demanding is beyond the limit. I'm not going to do it. If you want, you can hit yourself. So just move around neglecting it. If she is clever enough, she'll stop doing it. Or after some time, you can divert her attention. And in the course of time, she'll understand that, okay, beyond this point, even if I hit myself, it's going to injure myself, but it's not going to help.
Help.
So, yes.
Okay. We have another question. My daughter screams at the top of her voice when angry. How can that be controlled?
What do we do when we are angry? We shout, we scream at the top of our voice. And why are we expecting our kids not to shout? So, yes, shouting when they're angry is correct. So, as they grow up, when you're not getting your things done, you have to shout at some instances and get your things done. Subordinates, you need to shout when you're in your workplace to get the things done. Yes, shouting to some extent is okay. Beyond a point, yes, the why she's shouting, the reason she's shouting, you need to understand. If it is without any reason, then you need to just start neglecting it. If you keep on saying no, don't shout, no, don't shout, this is a lost warning, don't shout, then she'll use it like tempting you. Okay, when you are in a bad mood, whenever you are on call, she needs your attention, she'll start shouting. That's, she knows when she starts shouting, you'll come talk to her, get your attention. Kids are very clever, they shout just to get your attention also. So beyond a point, leave it.
So basically, kids do shout at the top of their voice to get parents' attention. So I guess
Yes.
we need to give more attention to the kids. Is that
uh,
that is what we have lot of queries from our tribers wherein they say my child is hitting if we deny something for her, if he cries at the top of the voice when he wants and he's very stubborn. So I think doctor has already answered all these queries, so you can just go back and see once the live session is done, so you'll get your answers there. So, doctor, we have an interesting question here. How to explain my boy that some things have to be eaten at a particular time only. He wants something once he sees that, he won't stop crying unless he gets to eat it.
Because at some point we are also at the blame in this scenario. I always tell the parents not to use food as a gift or a prize. You stop crying, I'll give you an ice cream. You do this, I'll give you a chocolate. You have done well in studies, I'll get you an ice cream. Or a particular, so this is a weekend, you have done nicely, I will go to pizza or burger. So what the kids associate is this particular food are a prize to me. These food are not a prize. This is just a torture. So I shouldn't eat this food. This is the prized food. I should always get the prized food. So they always grab for that prized food. So we should stop using the food as a gift or a positive reinforcement. And for example, suppose the kid wants to eat ice cream before dinner and he insists on taking ice cream before dinner. Talk to him, tell him you finish your dinner, then we can have an ice cream. He's not listening. Probably you can keep ice cream next to him. See, boss, the ice cream is next to you. You finish your dinner, you can then have the ice cream. Or if it's beyond his comprehension, you can form a strict rule, say you should always have your dinner before having an ice cream. See, I'm finishing off my dinner and then I'm starting to have my ice cream. You finish off, your box of ice cream is ready. Finish as quickly as possible, then take it. So first, in the way he can understand, at the end of the day, make a rule, and that might help him out.
Doctor, we have a question from Shruti who is asking, only milk without sugar also to be avoided. Like you had said earlier that you would like your patients to avoid sugar because and milk, which can, like make the aggressiveness worse. So,
See, most of the parents feel that milk is the wholesome food. Always give milk, milk, milk. So most of the parents feel the kid is not eating anything. I'll give him milk. So what the kid is saying is, boss, I'll drink milk. I'll play around. I don't want to eat anything. So he's getting most of the energy from the milk. Milk is a rich source of carbohydrate. Even milk without sugar will lead to a lot of energy. So toddler beyond 2 years or 3 years of age, I would say maximum 300 ml of milk per day. Don't go beyond it. If you can restrict even further, that's well and good. And apart from milk, we are getting exposed to a lot of junk food which contains a lot of sugar, cream biscuits, the burgers and pizzas, no matter what. The candies, the Kinder Joy chocolate, the other chocolate, which contains a lot of sugar. You need to avoid it.
okay. Doctor, we have a question from Jansi. Is being cranky and being aggressive both the same?
Cranky to cranky, I would say it's more of a mood issues, or at that point of time, the kid is not in a mood to do what you're saying. That's cranky behavior. That is fine for me because we don't emote the same way all through our life. Sometimes we are in a happy mood, sometimes we are depressed. So I do, sometimes we are also cranky. So kids being cranky once in a while is fine enough for me. At the end of the day, they are tired, they come back just from school and you're asking them to keep the clothes in the proper place, they are cranky about that. That's fine enough. Or you are waking up early in the morning, they're cranky. That's okay. Whereas aggressiveness, in the way I say, I see aggressiveness is beyond a certain limit. So hitting other kids, biting, throwing things around, or just to grab your attention doing a particular kind of thing, or you call them to do a particular work and they're not responding to you, particularly they're screaming and saying no, then I would label it as aggressiveness. Crankiness is still okay. Aggressiveness to some extent is okay. Beyond a point is pathological.
So, doctor, that was all the questions we have from the tribers. Do you have any other additional tips or tricks that could work for us parents to tackle such aggressiveness?
Uh, uh, yeah, as I summed up to my session, is one is listen to a kid, try to understand what they are going through, address the problem the kids is having, and in a toddler age group, being I would say discipline or being firm with your decision, and every time the kids behave in a particular way, emote in the same way, One of the if the child is shouting and the father scolds the child, the mother goes immediately and start consoling the child. That doesn't help. So when the kids does something wrong, they should realize that what they're doing is wrong. So emote the same way. Let them understand that this is the beyond the limit. Be a model person, so the kids are always copying you at the back seat. So the way you behave in front of kids is very important. um, set a routine for your kids, the way the time they get up, the food they eat. The routine helps. Moral stories helps in the kids, so make it a habit to tell them the story before they go to sleep. Set the rules of the house. Make sure you address them, at the same time let them not dominate over. uh, I think that should help, but way beyond, I think you need to consult your physician or the pediatrician if it's going beyond your limit.
Yeah. Okay. Thank you, doctor. Thank you so much for this wonderful session. You have taken time off of your busy schedule and given our tribers a wonderful session, and your uh, expertise in managing all these aggressive kids. I do have one at my home, so I know how that
All
one
parents
feels.
have it. Even I have it at my home. That happens. So as I told you, the kids should be aggressive. They should be mischievous. Probably we should reflect on ourselves, because we are going through a lot of stress in the COVID times. Our workload, to somewhere we are putting our burden on our kids. We are not letting them open up their wings and enjoy the way they want. More boundaries, more strictness. The more we hover around the kids saying not to do this, not to do this, then that's where they vent out their frustration or anger.
And I do always feel that probably we have not given the kids enough space to open up to the parents, and that is when the aggressiveness is increasing. I
Definitely.
often feel this.
Definitely. And also, we will understand our kid better if we are sitting with the kid and talking to them, instead of just labeling it as my kid is always cranky, my kid is always aggressive, my kid is not like the other kid. He is so nice. This kid doesn't sit in one place. Probably we need to spend more time with the kid.
Thank you, doctor. Thank you so much for giving us your valuable time. So, drivers, I hope this session was very much useful for all of us, including me. So, stay tuned with us on Parent Tribe by SuperBottoms for another wonderful and amazing session. We also have amazing contests and fabulous giveaways. Thank you so much. Thank you, doctor.
Thank you. Thank you. Have a nice day.